I had a television show called House Calls, well before the house calls that you see now on TV, and my wife
should have trademarked it.
Yeah, should have trademarked it. I could have made a fortune. My wife and I did it, and she was in charge of getting the doctors to come on, and the doctors would discuss with me and my wife, you know, different therapies and different techniques. And we had a urologist on. Urologists love to do surgery because they make a lot of money. They don't make a lot of money just doing urology, but if they can do a surgery, they make, you know, enough for a car.
Right.
So this urologist specialized in prostatectomies for prostate cancer. Well, there was a study that had been published just the month before this interview, and it was an American Hospital Workers Journal. And most doctors that worked in hospitals read it. This doctor had taken over 60,000 patients, and he had and there are several types of prostate cancer, by the way, several different cell types.
Mm-hmm.
He had even broken it down into the different cell types for prostate cancer. And he had compared it to total prostatectomy, radioactive seeding, and antiestrogenic drugs or chemotherapy.
Right.
And no therapy. He'd actually put no therapy in there.
Okay.
He found absolutely no difference between any of the four. None.
So basically, the bottom line, whether you got treated or not with any of the treatments, it didn't matter.
It didn't matter.
Okay.
So you'll never find an oncologist that can give you those studies. And that's when they get...
And if they've read that one, they certainly won't quote it to you.
No, they're not going to quote that to you. And because of quality of life. If you have your prostate gland taken out, there's a good chance you'll be incontinent.
Yep.
There's a very good chance you'll be impotent. And your quality of life is not going to be all that great. Knowing that you're not going to gain anything from it,
mm-hmm.
why on earth would you do it?
Sure.
But the funny thing is, I've had patients go to these charming oncologists that greet you at their office, and they're warm, and they're friendly, and they're cuddly like a teddy bear. And the patient will ask them for those two things. And that warm, cuddly teddy bear all of a sudden turns into a...
They just snapped.
...threatened animal.
Right.
And they no longer want to converse with you. If you don't, and their favorite thing is, well, if you don't want me to treat you the way I know you should be treated, then go somewhere else.
Yeah. You're not welcome here.
You're not welcome here. And not, if you don't want to be treated, there's a doctor over here that uses other therapies, or there's a doctor over here that will oversee your general health care.
Mm-hmm.
They never offer that. It's my way or the highway.
Right.
And that's
They're upset because they just lost their sale.
Yeah. Essentially, used car salesman.
Right.
You walked off the lot. And there's no need to be friendly anymore.
Right.
But that's a very good way to find out what they're made of.
It is. Yeah. And I mean, I've seen them snap in conversations with me personally, just discussing the treatments. When you back them into a corner and you show them that they don't have any limb to stand on, that's when they get mad. Right?
If
you can't argue with logic at the subject at hand, what you do is you get angry or you attack the person's character that you're discussing. That you're discussing it with.
That's right on the money.